For introduction, an emergency plan is an essential structure for taking firm steps toward the effective management of unforeseen situations, especially when injuries occur. The way the initial response to an injury is performed is likely to affect outcomes. Therefore, an organized plan and control should be predefined and relatable by all persons involved. This systematic guide explains completely what should be done immediately following an injury, assessment of the situation, administration of the basic first aid, and getting prepared for emergency medical assistance. With good education and just an ounce of preparation, anybody can act on an emergency with confidence and skills.
Hello, now we are moving on to the first general kinesiology technique, which is called posterior shin split. Let's check it out.
Tear the tape 2 inches from the end to create your first anchor. Place the anchor on the outside of the foot with no stretch. Peel back a paper from middle segment of the strip. Apply tape with moderate stretch under the foot and up the inside of the ankle. Lay down the second anchor on the inside of the shin with no stretch. And do not forget to smooth over the full application to ensure the tape is completely applied to the skin.
Moving on to the second general kinesiology tapping, we're gonna do tapping for stretch wrists. For the first strip, tear the tape 2 inches from the end to create an anchor. Place the anchor on the side of the thumb, no stretch. Peel the tape from the first segment of the strip. Apply the tape with light stretch along the thumb and wrist. Lay down the second anchor with no stretch, using the last 2 inches of the strip. Tear another small tape and peel the middle section of it. Apply it diagonally across the wrist under the thumb and make sure the ends meet at the back of the hand. Smooth out the tape after to make sure it is applied correctly.
Now we are moving on to the first edema kinesiology tapping technique. So this technique can be used for swelling and inflammation on the knees.
Using 2 stripes, cut into 4 smaller stripes with a rounded edge. Start on the outside of the knee and apply across the painful and swollen area. Lock the first small stripe and then pull it down with 20% of stretch. Use the same technique for the second, third, and last stripe. And then repeat on the opposite side using the crossing pattern.
now we're moving on to the edema kinesiology tip, which is the fan-shaped cut tape.
Use one or more strips depending on the size of the swollen area. Cut the tape into fan strips by making multiple longitudinal cuts, leaving the base intact. Place the solid base of the tape near the wrist or forearm for stability. Apply the strips lightly over the swollen area. Spread the strips like a fan over the swollen area, avoiding wrinkles in the tape. And lastly, rub the tape gently to activate the adhesive and ensure it stays in place.
Okay, so we're moving on to the triangular bandage. That is the first one, the minor head injury bandage.
Using a moist triangular bandage, and fold an inch on the base of the triangular bandage and put just above the eyebrows victim. When tying the bandage, please do it softly and make a double knot to make it secure, and the excess bandages can be tucked in.
So the second triangular bandage will be the arm sling injury bandage.
When doing the arm sling bandage technique, the opposite base of the triangular bandage must be pointed at the elbows victim, and the elbows victim must be above the normal elbow position. Make sure to pin or clip the excess bandage near the victim elbow.
Begin by holding the edge of the bandage between your thumb and forefinger. Start wrapping around the wrist beginning at the base of palm and wrap several times. Wrap diagonally through hand and palm and repeat 1 to 2 times. Continue wrapping up wrist overlapping by 1/2 of the previous layer. And in halfway between wrist and elbow, secure the bandage with the elastic clips, or if using the self-adhering bandage, by smoothing out the end.
Next we're moving on to roll bandages for knees.
Begin wrapping the bandage just below the knee joint. Secure the starting end of the bandage by wrapping it around the leg 2 until 3 times. Ensure it's snug but not too tight. Bring the bandage up across the knee. Cross it behind the knee and come back down, creating an X shape. Repeat this pattern overlapping each layer slightly for support. Continue wrapping until the knee is fully supported, covering the area above and below the joint to stabilize it. Lastly, secure the tape.
So this is for the last roller bandage on the leg.
Start above the ankle level and wrap around the leg and overlap all the bandage, half of it, and don't leave any gaps when wrapping the leg. The gentle pressure from the elastic roller bandage can help reduce swelling and the injured area feel better.
Good morning everyone, so this is rigid tape and this is how to use it in technique lateral knee ligament taping.
Here are step-by-step instructions for lateral knee ligament taping. So for the first step, cut 2 pieces of rigid tape, each about 10 to 12 inches, and make sure the area is clean and dry. The second is, have the person sit with the knee slightly bent, about 30 degrees, keeping the leg relaxed. Begin at the outer side of the knee, just above the joint, and apply the first strip of the tape diagonally across the knee towards the inside of the thigh. Gently stretch the tape as you apply it, ensuring it follows the natural contour of the leg, providing support the lateral knee. Press the end of the first strip down securely just above the kneecap on the inner thigh. Repeat with the second strip, crossing it over the first to form an X pattern for add support. Make sure both strips are secure and lay smoothly without wrinkles or tension. And last, the tape should fit snug but not too tight. Ensure there not discomfort and the knee is supported.
In conclusion, a preparedness plan for handling initial injuries is important for quick and efficient response during emergencies. Immediate action taken after an injury, even action taken by a bystander, could much influence the final outcome. Most importantly, making an injured person stable, minimizing complications from the injury, or preventing further harm, and also saving lives. Keeping calm and giving first aid while making sure a professional is contacted to provide additional care can boost a person's chances of recovery. Regular practice of first aid procedures and familiarity with your emergency plan could spell the difference between the safe and efficient management of unforeseen injuries. Being prepared thus a bargain between an emergency becoming deadly and being treated with confidence and skill.